as anyone who's been pregnant will know, if you look at the number of apps on mobile phones and books on the bookshelf in Waterstones and W.H. Smith, you know that we can't possibly cover it in 20 minutes. So I'm going to pick on some, what I think are quite important points, and then we can pick up where we left off in the Q&A. So, as most doctors will tell you, a healthy pregnancy starts way before conception, and I think Mary very elegantly demonstrated that in the last talk, and I'm going to say lots of similar things now. The reality is that very few pregnancies, surprisingly few, are actually planned as much as you might expect. We've actually done a little bit of research on this, and about 30% of the pregnancies that come through our own antenatal clinic are actually definitely planned. Some are not planned but not exactly prevented, and some are complete surprises. So we say this with that in mind, but we really should be trying to start folic acid supplementation pre-pregnancy. And I'm often asked, how long before? Well, as long as possible, but ideally 3 months before, to make sure that you are folic acid replete. Folic acid is essential for building a healthy baby. It contains the building blocks of life. And we have a diet that's remarkably poor in folic acid in Ireland, and as a population we're particularly vulnerable to the effects of folic acid deficiency. So it's a really important public health message that we should start folic acid pre-pregnancy. And in that vein, it's also important to try and get fit before pregnancy, into optimum fitness. It's good to aim for a healthy weight, and I'll talk a bit more about what a healthy weight is shortly, and also what a healthy weight gain in pregnancy is. Ideally, we should stop smoking pre-pregnancy. It's always harder to quit during pregnancy. As anyone who's been pregnant will know, it's quite a stressful time. It's an important and happy, but often quite stressful time. And stopping smoking when you're stressed is really difficult, so it's a good idea to stop before. But if you haven't, don't panic, because all the data suggests that if you do stop smoking before 15 weeks, then your baby's birth weight and other complications associated with cigarettes will be minimal. So if you're still pregnant at conception, just make every effort to stop by 15 weeks. You should cut down on alcohol because it does increase the chances of spontaneous conception, as Mary flagged. And you should enjoy a balanced and varied diet. There's a huge amount in the lay press at the moment about fad diets for this and diets for that, and some of them have been shown to be actually quite detrimental to health. So balanced and varied is the key. And particularly for women who have an underlying medical condition. And as we are getting older having babies, and we do pick up more conditions as we move towards our 30s and 40s, it's important to flag that if you do have a condition, then it's important to check with your GP before conception, particularly if you are on medication. And the kind of things that we're talking about are women who might be on medication for epilepsy and women who might be on medication for hypertension. Those women should speak to their GP before conceiving, because some of those medications, it might be beneficial to change them to medications that are more appropriate for preconception and for pregnancy. Women who have really complex conditions like diabetes, and we're seeing a lot more diabetes in women of reproductive age, really would benefit from more advanced pregnancy planning. Unfortunately, preconception care with obstetricians and gynecologists isn't uniformly available across Ireland, but there are some excellent clinics within Dublin, and there's a preconception care clinic in Cork where women who have quite complex medical conditions can avail of full pre-pregnancy planning. So that's for those women who go into pregnancy with one or two medical conditions.